This is my audience for speech 4.
When we reach the end of life, we won't know what to expect. There are standards of care set in place for those who go into sudden cardiac arrest, or if we get put on life support for any X amount of time. But what if you aren't that individual and you end up growing to be old and you are faced with a terminally ill disease such as cancer, and you do not pass quickly by cardiac arrest? It's not the length of life you live, but the quality in which you live it, which is why I believe that euthanasia should be legal in the United States. First of all, what is it? While doing my research, I learned there are different terms to this subject, if you will. They all have the same end goal, however, they have different limitations to describe each one. For instance, euthanasia, I have found that is to use the lethal force, such as a drug, by a third party to end one's life. PAS, physician-assisted suicide, is a prescription of lethal means by a physician, but the patient administers this themselves, according to Shibata, one of my resources. And lastly, AID, assistance in dying, allowing the physician to prescribe a lethal dose to a patient who is alert and terminally ill, according to Bookbinder. Now, I will go over the reasons why I feel like this technique should be allowed and offered to individuals. It is currently legal in 6 states, California being one of them. California's End of Life Option Act allows a patient with 6 months or less an ability to obtain a prescription from their doctor to end their life, according to Petrillo. The End of Life Option Act requires the doctor to explain alternative motives, which only makes sense because before you resort to one option, you want to know all your obvious other choices, which are like hospice, palliative care, pain management, so forth. Next, the Respect for Autonomy and Dignity of Dying. Oregon's Death with Dignity Act provides benefits for the terminally ill because it gives autonomy, control, and choice, which are very important for that dying patient, according to Bookbinder. A couple things that Shibata says also is the respect for autonomy has been demonstrated in the right of a competent person to refuse medical treatment. This is true. Nurses and doctors see this daily. Patients refuse all kinds of medical treatment, and they have that right to do so. Shibata also says when patients do refuse medical treatment, which may hasten their death, however, ability to refuse treatment may not be sufficient to relieve suffering in certain situations. In these situations, aid in the form of euthanasia and PAS may be supported with principle of justice. Petrillo also found that 72.5% of older adults in California support the idea of PAD. They found that out by a survey done by Periacoil. I can't really pronounce that. The next reason is eliminating someone's pain, suffering, and discomfort. Cancer being the number one, usually that's what it is when people talk about euthanasia. When people have cancer, sometimes in the later stages, it usually metastasizes to other organs of the body, sometimes the brain and the bones, which just creates more problems for that individual. I feel the patient has the right to make a decision at that time when they are in their right mind if they would rather go with euthanasia, PAS, as opposed to chemotherapy or radiation, because that could be hard for some people, as it was for my mother when she was going through cancer. Next is to alleviate unnecessary medical bills. Meds used at the end of life are usually like Roxanol, Ativan, Haldol. Those are given to the patient to relieve their anxiety, their restlessness, their discomfort during the dying process. If a patient says that they would rather go with euthanasia as opposed to going with palliative care, these meds would not be needed. Side note, for organ donation, I know plenty of people are organ donors. According to Ball, voluntary euthanasia enables a person to be able to still donate their organs if they choose to end their life this way, which is a plus. Lastly, common, I know, however, my last point, animals have the option of being put down. And I know that this is a common thing with euthanasia. However, I feel that in this sense, they have a greater advantage over humans in a sense, because humans should be granted the same thing. As a pet owner, we make the discretion once we know our furry loved one, once they start struggling to get up and walk, or you can tell that they are uncomfortable, we make that decision that maybe they need that last visit to the vet. Why as humans can't have that same opportunity? And lastly, my last thing to say, Shabbat also states, confronting the end of life is something we all face. It is a daunting task that we must all deal with in our own way. At the same time, because our lives are bound to society and the people in our lives, the options we will be given at the end of life are framed by ethics, law, and policy. With that being said, the act of euthanasia should be offered to people who are at the end of life. Their life and request to have assistance with dying. It allows that individual to leave this world with dignity. I'll show you my note cards now.